Welcome back, everyone, to the Retirement Success in Maine podcast. My name is Ben Smith, and joining me, as always, is the ice pack to my sore hamstring, the foam roller to my tight back, my co-host, Curtis Wister.
I'm starting to get a little concerned, Ben. We're getting a little specific with these examples and ailments here. I don't know what's going on.
Well, yeah, well, of course, that's because today's episode's hitting close to home for a lot of us. And one thing we hear constantly from our clientele and retirees is they want to stay active
Yeah,
and they want to travel, they want to play golf, they want to hike, they want to play with their grandkids. But sometimes the body doesn't always cooperate the way it used to.
yeah, that's right. And sometimes that's because of maybe specific injuries or surgeries, but other times, it's just accumulation of years, right? We have arthritis, back pain, shoulder issues, knee issues, things that generally start to limit mobility and maybe even our quality of life.
And that exactly, we've had strength coaches on, gym owners, and we've talked mobility and staying active. But today we want to take a slightly different angle, and that is the physical therapy perspective.
That's right, Ben. And that's because, physical therapy isn't just what happens after surgery anymore. It can also help manage chronic conditions, reduce pain, improve movement patterns, and keep people doing the activities they love.
Yeah, and today's guest is someone I've personally worked with. And as some listeners know, I'm always trying to improve my own golf game. And our guest today has helped me work on mobility and movement patterns that not only help me swing, but frankly, are the same things that many of us should be strengthening as we age.
That's right, Ben. And so, everyone out there, whether you're trying to recover from surgery or reduce pain or simply just move better in retirement, I think this conversation should be really helpful for you.
Yeah, so our guest today is Dr. Travis Deabay, founder and owner of Deabay Physical Therapy here in Maine. He grew up in Millinocket and has always had a passion for the outdoors and staying active. That interest in both medicine and fitness led him to pursue a doctorate in physical therapy from Husson University, which he completed in 2013. After beginning his career working in Rhode Island and Virginia, he returned home to Maine in 2016. So we like the boomerangs. His advanced training includes the functional movement screen and selective functional movement assessment systems, which focus on analyzing how people move to identify the root cause of pain or dysfunction. He's also certified by the Titleist Performance Institute to help golfers improve their mobility and performance. And his initial training includes vestibular rehabilitation, trigger point dry needling, and the Graston technique. He started his own practice providing in-home physical therapy, allowing him to keep a smaller caseload and focus deeply on each patient's needs instead of rushing through appointments. He also serves as an adjunct instructor at Husson University's physical therapy program. So at this time, please welcome Dr. Travis Deabay to the Retirement Success in Maine podcast. Welcome, Travis.
Thank you. Thanks for having me today.
Yeah, we're excited to have you. And I know with our show, we'd just like to get a sense of you a little bit, Travis, and just kind of hear a little bit about your background. So, love to hear a little bit of what drew you into physical therapy as a career.
Yeah, so I got here a little bit different way than some people. I was just generally interested in medicine, and I'm not certain 100% what drew me in that direction, even when I was in high school. But I wanted to initially become a physician assistant. I thought I was going to get into emergency medicine. I started college at the University of New England and was able to actually even get my EMT basic license in my first year, first and second year. So started working up in Millinocket, East Millinocket on the ambulance, and really enjoyed it. Super exciting work most of the time, but kind of started to realize that I didn't want that kind of degree of pressure and that kind of responsibility of like life and death decisions on my hands. So, I had shadowed physical therapy a couple times. A few of my friends in college were in the program, and I kind of realized like this maybe fits a little better in terms of being in the medical field. I always loved athletics and being active, so started just go down that direction. And then I transferred up to Husson to complete the undergrad and then the doctorate phase.
Yeah,
Nice.
that's
Yeah.
great. That's great. And I know we just kind of read this off, but of course you grew up in Maine.
Yeah.
But then for a short period, it sounds like kind of worked and moved in other areas, other states, but then of course returned back here to the
Mhm.
state of Maine. So we just like to ask, again, we're here in Maine. So what kind of led you to come back to Maine and really build your practice here?
I was always going to come back. I think it was just
Yeah,
like a little mini adventure. I wanted to
Mhm.
go see some different areas, try
gotcha.
out different parts of the country. I thought maybe end up doing like full blown like travel PT for a little bit, but ended up just finding a couple good jobs, a few good areas. But realized pretty quickly being in both, like wanted to be closer to home, family,
Yeah,
friends. Yeah,
yeah, of course.
That's the pull that Maine has, I think, right? Is
That's
it's
right.
yeah,
it's tough to kind of leave the family and friend, and again, it's a great place to live. So we're very
yeah.
fortunate to be here. So Travis, love to obviously you eventually started your own practice with an in-home model and smaller
Mhm.
patient load. Can you talk a little bit about that motivation behind that approach and maybe why kind of your own practice was a little bit better for you than maybe joining an established one yourself?
Yeah, I was working. So when I came up here, I was working for an awesome company, Dragonfly Physical Therapy, and in that, I kind of grew up within that company, but saw myself like wanting to just start my own thing at some point. And so it was the combination of wanting to start my own practice, seeing a huge need in the kind of in-home model, with insurances cutting back on home care more. There's a lot of people that get caught in between where, yes, they can get out of their house, but they don't necessarily, it's not very easy for them to. And then there's the clientele that's just like incredibly busy. So I was working with two groups of people, like seniors that were having difficulty getting out to a clinic, and then people who was like, I can come over, you're working from home. It was right after COVID. Pop in for an hour. You don't have to go travel anywhere. Your appointment's entirely wrapped up within 45 minutes rather than your 10-15 minute drive waiting in the waiting room, that sort of thing. So it was that seeing a need, being able to then have my caseload structured and really focused on just a few people and one person at a time, getting all of my attention. Um, and to be truthful, like me being pretty risk averse in starting my own company, that was a way to do it with very low overhead, for
Mhm.
just the cost of what equipment I could buy. And I don't really need a lot to kind of get started, and be able to drive around and do that sort of thing. Um, Unfortunately, what I ended up finding is that that was a great way to start my business. I made a lot of great connections, amazing folks that still come and see me here in the clinic. Is that I was physically like wiring down from all the driving. So
Yeah.
it got so busy that I was like, I'm just like burning myself out here. Um, so
Gotcha.
yeah, I still get a lot of referrals for it, but now I'm mostly exclusively just here in the clinic, 95% of the time. A few
Gotcha.
folks that have kept with me, but yeah.
Gotcha. Gotcha. No, I appreciate you kind of laying that foundation for us and really want to kind of dive into today's conversation. It's all about, moving better, feeling better, and that relationship that physical therapy can have with that for, specifically retirees for the sake of this conversation. I think a lot of people, even including myself, probably lump physical therapy as something into kind of what you do after a surgery or after a major injury, right? Can you just kind of explain, I guess, again, laying a foundation, I guess, again, if you will, of
Mhm.
what physical therapy actually is today and maybe the broader role it can actually play in somebody's health?
Yeah, so we certainly do a lot of post-surgical care, but most of it, particularly in my clinic, there are probably some clinics that do like most of what they do is post-surgical, but most of what I do is orthopedic evaluations and treatment of everything from your ankle sprain to tendinopathies. It should be like your people know about, tennis elbow, golfer's elbow, low back pain, and we're kind of the first line of defense in those conditions. You may see your primary care, then see the orthopedist. But oftentimes they're going to say, if you haven't tried conservative management with like structured exercise, manual therapy, different interventions that we have with dry needling, whatever it might be, you need to start there. And then, yeah.
Hmm, awesome. So Travis, I'm just obviously I'm working with you on the golf side, right? So,
Mhm.
and part of it in my head was here we are doing this podcast, and you kind of look down a road and you hear a lot of advice about, geez, you gotta stay mobile and you gotta work on your balance and you gotta work on, just making sure you are a stronger version of yourself to allow yourself to stay independent as long as you possibly can in your life. So, but obviously picking up the phone to anybody or dropping an email or is can be a little intimidating because you don't know what to expect, right?
Mhm.
So, love to just hear about if somebody's contacting you and they go, "Hey, Travis, I'm reaching out to you. What should someone expect at their first PT appointment? Like, what would be the I'm reaching out, and again, I'm fearful of a lot of things of maybe judgment. I'm fearful of, the state of where I am today. What would, I guess, if you're kind of on the other side of this, I'm receiving somebody for the first time. What would they expect as terms of maybe what they could receive as kind of the meeting you and kind of what they would get in that first appointment?
Yeah, no, that's a good question. It's easy sometimes for me to forget that that could be intimidating as something that I'm just doing every day. But it certainly could be. The first visit coming in is really, we do tell people be, in loose clothing that you can move around in because that's important. But the biggest part is a conversation to say, what's going on? What are you struggling with? How does that impact your daily life? What are your goals? And then really too, I think in terms of the intimidation portion of it or the anxiety around that, I always tell people we need to make this fit in terms of the time commitment and the financial constraints are often the two obstacles. Sometimes it's totally covered by insurance, so we can knock one of those out. But oftentimes people nowadays in particular are dealing with high deductible plans or larger copays, co-insurances. So we try to make it fit whatever is going to work for that particular individual. So it's really that conversation is the biggest part to make sure it's going to fit within your life. And the second part is the evaluation, kind of seeing how you move, strength, range of motion, but trying to keep it as comfortable as possible because some people are coming in quite a lot of pain, while others aren't. They're just looking to kind of address some little kind of things that come up here and there.
Mm-hmm.
I like that. Sounds like a good way to just kind of get to know each other because ultimately it is kind of a relationship that you're building with these individuals. So that's
For
super
sure.
helpful. I want to go back to maybe an angle I teed up in my previous question, which is the PT post injury or post surgery, right? I think that is probably one of the more common reasons we see people maybe seek out a physical therapist. And of course, correct me if I'm wrong there. I know we're talking about other reasons to seek you out, but certainly as we age, maybe recovering from an injury or surgery. So, we have knee replacements, we have hip replacements, we have rotator cuff issues. I guess my question for you, Travis, is what role does physical therapy play in helping somebody then regain mobility and honestly confidence, right, after these
Mhm.
types of procedures?
Well, yeah, for sure. I mean, confidence is a big part of it too. When we start off, it is all about for most of these surgeries, it is all about mobility and being able to regain. I think about mobility as like range of motion in your joint. How well
Yeah.
can you move that particular limb or your torso, whatever it might be? An example of a rotator cuff repair, those can be kind of long rehab processes, and people don't often know that going into it, how it's going to be. But for the first so many weeks, depending on your surgeon and the degree of the surgery, I'm just going to be moving your arm around, keeping it limber, keeping the fluid moving. Then it goes down to, for a hip replacement, people are moving quite well, sometimes don't even need a whole lot of PT. We're just going to end up then working more on strength, and it varies so much. I have
Sure.
sometimes more people after a hip replacement who are incredibly fit, strong, and active, who then say, how do I get back to the point where I feel comfortable swinging a driver as hard as I can, or
Yeah.
bending down to pick up my grandkids, doing yard work, whatever it might be. And so sometimes I work with them even longer than the folks who are just pretty content doing their daily walk and moving around their house.
Hmm.
Yeah.
Travis, it feels like then I gotta mom right now who's scheduled to have hip replacement surgery in like another, I don't know, week and a half or
That's it
something.
soon. Yeah.
And it's amazing to me because it feels like there's might be a this is just an observational change, but it feels like she's already been doing kind of the PT work because
Mhm.
she's strengthening and just even though yes she has an injury that needs to be repaired and replaced, she's already been doing the strength training so that when I think post surgery when she goes back to doing PT, she's kind of already has all this muscle already built and it's maybe a faster
Mhm.
recovery. Is that a change that has maybe been more recent? It feels like it sounded like to me that I would, again, someone that doesn't know, but
Mhm.
that is like, hey, I get an injury, I have surgery, then I have the rehab and I have PT. But it sounds like
Mhm.
there's maybe some more proactive nature that's been happening a little bit more. Would agree, disagree?
Yeah, I think there's both sides to that because they did definitely used to do a whole lot of like prehab before, say, even ACL or reconstruction, total knees, and sometimes it's still needed to be able to kind of make sure we have the best kind of condition going in. But there were a number of research studies that showed that the outcomes weren't dramatically different. So then I think people stopped doing it so much. But then there's just like a lot in our society. You have people who are super health conscious and those who maybe aren't so much. And those who are more health conscious are getting in more now again, as you're pointing out, to get those exercises in, get familiar with them, build some strength, be able to go in as good a condition as possible. So, yeah.
Yeah, yeah. It's just I look at that and go, it
Mhm.
does make sense that maybe there's some better outcomes. Where it's your
Yeah.
what you just said is this isn't the first time she's ever done these movements, and she's already been working on it and doing it, and
Mhm.
hopefully gets her back on her feet more quickly. But I want to ask a question about a little bit different about chronic conditions, right? Managing
Mhm.
chronic conditions through movement. And I know many retirees live with chronic conditions like arthritis, diabetes, heart disease, and say chronic back pain. Can you just talk about the role of physical therapy here helping to manage these conditions,
Mhm.
especially to reduce pain and limitations?
Yeah, for sure. Arthritis is one that comes up on in a daily conversation because I have a lot of people that come in and have already had imaging shows that they have arthritis in their shoulder or their knee, and sometimes they're a little reluctant to even be in PT and say like, "Well, what are you going to really do for me? The arthritis isn't going to change." The answer there is that no, it's the imaging results are not going to change. Well, we after we do PT exercises, stretching, whatever we're going to do go back and have that x-ray, it's going to look the same. Or I mean, you're a year older now, so maybe it's even worse.
Yeah.
But
Hmm.
what, again, going back to research, shows very objectively that people can get much better, not only in terms of their movement, strength, range of motion, but also in terms of their pain, even in the presence of that significant arthritis sometimes, um, which is where you can really get fooled based on what somebody looks like, what the root cause of their pain is, and then what the imaging shows. And it's not as though imaging doesn't have a super high value. And it's always nice to be able to look at it and marry the clinical presentation with the imaging results, but um, not always one for one in terms of how you can feel overall. So that is something that I have a daily conversation with people about. And it's one that I try to point to research and say, you don't have to take my word for this. Look at these massive studies that show people will get better. Not everybody. And that's why, orthopedists have super long wait lists for joint replacements too. So
Hmm.
we look at like, you mentioned heart disease. That's a case where sometimes, again, going back to Curtis' question about confidence, um, being able to grow in an exercise program while somebody like a physical therapist is monitoring vitals, keeping close eye on you, teaching you how to safely push yourself again and get stronger, more mobile. And like chronic low back pain, that's kind of right in our wheelhouse of something that I'm treating most of the time. That's a large percentage of our caseload. So yeah.
Gotcha. Well, I want to ask another question, Travis. And you've done advanced training in functional movement screen and selective functional movement assessment.
Mhm.
And again, I came to you through the Titleist Performance Institute side, right? So around kind of, which I'm sure sounds like it goes hand in hand here.
Mhm.
So, but I just, from me, kind of going like, hey, there's things in my golf swing where it's like I feel like I wasn't able to move correctly to then get in a proper position.
Mhm.
So to be able to assess those movements, where the limitations are, and then go, these are the exercises you need to do to then improve allow yourself to get to these things. Can you talk a little bit about those systems? And again, maybe not golf specifically, but what the systems are and how kind of they help you analyze someone's movement patterns so you can identify problems that may not necessarily be obvious, I guess, to if maybe myself, even just kind of if I'm being assessed myself, that I wouldn't even know I'm limited in this way.
Mhm. Yeah, for sure. So, and it's actually the Titleist Performance Institute and the SFMA are closely connected. Greg Cook had worked together with the folks at TPI to kind of develop their overall assessment process. And what it is basically a way to look at global movement and movement patterns. For example, your ability to touch your toes. Previously, the standard is, can you touch your toes? And if you can, good. If you can't, we need to stretch your hamstrings. And that's, I mean, the simplification. I'm sure there's a lot of great other evaluation techniques to be able to tease this out. But the SFMA would look at that and go, okay, he can't touch his toes, but why is that? Let's take that movement pattern. We have like different quality measures on it to see how well is your upper back moving, how well is your lower back moving, your hips, your knees, your ankles, and be able to then break all of that down to the requisite movement patterns within each joint and say, where is this coming from? Okay. And they then can point to more direct root causes of it. And almost always is not tight hamstrings. It's some other way in which you move. But it's easy to point to something like a tension in your hamstring kind of sensation when that's what people feel. But it's really because they can't shift their weight back or they don't have enough hip range of motion, that sort of thing. So it's basically a way to look at global movement patterns, squats, toe touch, backward bends, all of these things, and then break it out into the different joints and other limiting factors. Hopefully that makes sense.
Yeah. Gotcha.
Yeah, no, that's great. I'm just sitting here thinking that not to make this a commercial for you, Travis, but now I'm like, man, I might need to go here because I got Ben doing the Titleist stuff. I got other people I know doing it.
Yeah.
Taking over my golf circles here, Travis.
It should, for sure.
But no, I want to ask another question for you. I think we teased it in the very beginning, but we've had a few conversations with strength coaches or various gym owners on this show, and not trying to pin you against strength training or anything like that, because I think it's all more connected than even people realize. But we talk a lot about mobility and exercise, and again, the previous angles we've taken have been from a strength kind of training perspective. But I want to ask, obviously, from your perspective now, right, as a physical therapist, what's kind of the difference between rehabilitation focused movement work and kind of general fitness training? Like what's kind of the give and take there?
Yeah, no, it's definitely there's a ton of overlap, and you'll have more often than not, I would say, people come to me and they are in pain. I do work in a hybrid model, so I have folks who will come to me because they want to just move better. I'll have folks come to me because they've heard about the TPI and they want to work on things related to their golf game. But most people come to me because they're in pain. And so what I'm trying to do is help you get out of pain, help you just move better. And then typically my job will end there when you are feeling better. We've got you on a home exercise program, things you can keep going with. And I encourage so many folks then, please go continue this journey. Use this as like kind of your launching point to go do some strength training, go to a gym. I have several folks who I recommend people to all the time. I see a strength coach on a regular basis because it helps me so much. I learn from him. And there's overlap there because I go see John Gagne at Hybrid. He oftentimes is, or not oftentimes, is always looking at not just building strength, but how do we get people moving better? So,
Gotcha.
Yeah.
Well, so you brought up something, Travis, about obviously people coming to you because they're in pain oftentimes,
Mhm.
right? And I know from, there's a lot of, I think, there's been a lot of conversation about pain treatment over the last maybe couple decades too, and maybe chasing symptoms here. So again, a lot of people treat pain with medications, really short-term solutions, right? So if I just take, more ibuprofen, I just take some more Tylenol and,
Mhm.
which obviously can just mask things, but talk about in terms of PT approach here, differing in terms of addressing the underlying cause instead of just treating symptoms, right? Because I could see where there can be skepticism like, hey, you made the pain go away, but did we really make the whole thing better, right? So
Mhm.
just talk about your approach there when hey, someone's coming to you and say, I'm in pain and it's my lower back and
Mhm.
that's where it's radiating and I'm feeling this. So how do you kind of root those things out, again, symptoms and in treating pain?
Yeah, so that's a good question. So we uh, are going to hopefully be able to have some test retest measures in terms of your movement patterns, and that's where it comes back to how we use our assessment, which is SFMA or another kind of different assessment technique that I'll use to say, okay, your back hurts here. How do your hips move? And after we do an intervention, then how do your hips move? Right? If we can pick up mobility in one direction, then we know our intervention is helping. Now, that's our assessment technique is not hopefully just focused on that one area of pain, but looking at if it's your back, how do your hips move? How strong are you? What do your ankles look like? How does your big toe move and how that could impact your gait pattern and then throwing everything else off up the chain. So people have a pretty good working understanding most of the time that we're a very interconnected system and the how you breathe and hold your posture can be impacting everything up and down from your feet all the way up to your neck. But sometimes we don't always have the ability to assess that well. And so that's where we're trying to do that and root out those different things. And to your point, yeah, your pain has gone away. That can just happen over time, but how do we make sure this doesn't happen again? And that's where we're looking at, okay, we have improved these different movement metrics, which will give you the best chance for this to not come back again.
Gotcha.
Yeah.
So I'm gonna pick on myself here a little bit, Travis, and obviously we're gonna talk a little bit about our relationship together. But I do want I think it's helpful as a little bit of a case study here, and maybe for listeners that are out there. And again, I've mentioned that I came to you through again working on my golf game and the Titleist Performance Institute program, right? And I think what's interesting, as you said, is like I think because I've had a lot of mobility challenges, right? Being working at a desk and sitting
Mhm.
with people and like just sitting in a chair, I think for my entire career or in a car going to people to sit in a chair, right? Is like just it feels like I've that's the focus of my life has been doing that vocation, right? So it then creates maybe mobility issues where like I feel like I've had very poor balance, and all of a sudden I get into my golf swing, and I'm like I'm getting on my toes, and then I'm falling forward as I go to kind of release the golf club, and or my rotation, I'm maybe too tight to maybe. So it's like all these mobility, rotation, balance, which to me was a lot of, I think, the issues that I hear people talk about as they say, hey, I'm 65, 75, 85, 95, and I'm dealing with balance issues where I'm struggling when I go upstairs or I can't really like rotate and reach for things. So, can you talk a little bit about maybe explaining movement for sports, how it really overlaps with improving function in everyday life and kind of what you kind of see there?
For sure. Yeah. I mean, you brought up balance too as one of the key points. It's something that I'm always checking in folks. And that's been one of the biggest eye openers when I started a few years ago working with folks through this TPI assessment and people who are coming into me who were not actively in pain. And the biggest takeaway from the first 8 to 10 people I worked with was recognizing that they did have balance issues. And that was so eye-opening to them to say, I'm glad that we did this to now know I have something I need to work on. Because almost everybody in their life has witnessed parents or grandparents getting older and seeing them losing their balance and falling and having devastating injuries, and then saying like, man, how can I not have that happen to me? And there's no way to prevent our balance getting worse as we get older entirely, right? I mean, your 20-year-old is always going to have better balance than your 90-year-old, but I certainly see a lot of 90-year-olds who have put some time and effort into exercise and working on their balance who have incredible balance. And so we know that that is very possible. And it's just a matter of maybe being aware of it and then being able to work on it. In terms of other impairments, everyday life, so much of people's shoulder pain ends up being that they don't have yet is related to not being able to move well through their upper back and being able to extend and rotate in different areas. Back pain, again, being related so much to hip mobility, which is a problem, probably largely and in some part due to sitting so much. So, yeah.
Yeah, and I'll add, Travis, is I've gone through a couple rounds of really extended lessons with golf coaches, and I think the first time where I was really getting into golf, and kind of after we established this business and got the CFA designation, and I did all these things, and I was like, hey, this is my time, and now I'm gonna go work on golf and get better there because I want to enjoy it. I think I spent a lot of time working on a golf swing, which I did not have the strength to do. And I think what was really clear to me, I'm working on things and I'm complaining, like I'm getting over on my left side and my ankle is going over the left side of my foot. And that was just stretching ligaments on my ankle as I was trying to shift weight to move towards the target. And I'm just not able to move, and I'm hurting myself as I'm trying to swing the golf club properly to instruction. And I was able to do that and take instruction and translate that into a golf swing in the short term. But then I receded back to old habits because it was painful to do that swing. And I didn't have the strength built in all the key areas to then maintain all the instruction I got. So then I went back to bad habits,
right,
and things that were not painful, which then undid a lot of the key lessons I think I had learned along the way, which now that I have yourself and I'm working with Chad Curley at SimCity here in Bangor, and the two of you combined, it's like I'm doing strength training with you and kind of the mobility piece, and then I'm getting proper instruction as I'm getting kind of all these core pieces. So now it feels like, to me, it's like I got this recipe and it's sustainable and I can do something with it. But I kind of look backwards as like, if I had done this a little bit differently, if I had maybe focused as much on kind of the strength training and the mobility and finding limitations, I would have been able to do a better job with kind of the money I was paying on the lesson side and gotten to the result I wanted more quickly. So that's a personal highlight I just want to get your reaction to, but I think that was something of a lesson of me is I should have done this way earlier.
Oh, for sure. Yeah. Yeah. I mean, you mentioned like the strength piece of it is so important for so many people, and not just in their golf swing, but as you mentioned, how does that go to everyday life? Just being able to bend down and pick things up in the way they should be able to, and didn't know. But then, looking at the golf swing and, how different strength or mobility limitations are affecting their ability to properly get into the position they want to, and not understanding like, why can't I do that, or why can't I consistently do that? And sometimes it is just a motor pattern issue that you've got to go see Chad to help work on, how am I feeling that position? Sometimes he can be really wanting you to get to a certain position, but you don't have the shoulder mobility to get there. Right. So, yeah.
Exactly.
All right, enough about Ben getting better at golf. We're moving on. No, I do want to actually build on that a little bit, and maybe in not just the golf sense, but something that you both have just talked about a little bit there was balance, and vestibular therapy is something that I think we want to talk about a little bit. So again, something that comes up, I think that Ben and I see kind of in our day-to-day with people as they age. Travis, I know you just said it. Balance is a big one. And even just, dizziness, things like that. So I have kind of a two-part question for you, I guess. So the first part is, can you just explain to kind of us and our listeners what vestibular therapy is? And then the back half of that is kind of how can PT help people with these symptoms.
For sure, yeah. So the first thing about dizziness that I always tell people when they start talking to me about it is, if this is not something you're very familiar with in terms of why you're having those symptoms, go get checked out by your doctor, because you have much more dangerous conditions that need to be assessed there. But in terms of the physical therapy aspect of it, there's a few different main conditions we treat in physical therapy. The most commonly known is when you have these little crystals that can get kind of dislodged from where they should be. They help us to detect gravity. And when they end up in the semicircular canals, they start contacting hair cells and basically telling you you're moving when in fact you're not moving. And people get horrifically dizzy when this happens, and it's called like true vertigo. So we have these Epley maneuvers and a few other different techniques that can very quickly get people out of that state. And I see folks on a very regular basis for that. It's very satisfying to treat because it's one of the conditions that we can have people leave and they don't always feel great then, but then the next day they're like, I finally feel better. The other main thing is that as we age, sometimes one portion of our balance system, whether it's our eyes, our inner ears, or vestibular system, or our joint kind of proprioceptive sense, starts to decline. And then our brain is getting mixed messages. You may be getting signal from your eyes that you're moving at a certain rate, but your inner ears are not keeping up at the same degree that they were before. So it's like being on a boat when you get seasick, that your ears are telling you you're moving and your eyes are telling you you're not. So they tell you to look at the horizon, that sort of thing. So what we try to do then in physical therapy, long answer here, but is to try to get people to then have exercises that will teach their brain how to marry all of those systems back together again and get those signals, or interpret those signals in the correct manner.
Wow.
Yeah. Gotcha.
Yeah.
Because I'm thinking about, I got family members that kind of suffer from that a little bit, and I can see where that's because it's like things like going upstairs, and like they're at a sporting event and they're going up the bleachers, and all of a sudden their eyes are telling them one thing about the depth perception, and it's not really, and then they're feeling faint and dizzy, and they need to brace themselves. So yeah, it's very alarming because I think they're like, like I feel fine, but all of a sudden I got a sense of dizziness and everything looked the same, and I didn't think it was as far, and then I went to go lean and grab a seat, and it was way further than I thought, and it looks really alarming to everybody.
Yeah, and that's one condition too, where it's much easier if you start to recognize that happening and get in. And these are usually quick kind of plans of care, in a sense, where people are coming in. Here we assess, this is what we want to start working on. Take these drills and work on them for 3 minutes a day for the next couple of weeks. Come back and see me again. Just a few repeated visits, and people are usually feeling a ton better. Wait until it's gone on for 10 years and you really have a ton of balance issues. It's just harder to treat at that point.
Sure.
Gotcha. I want to ask about, to what you just said, actually, staying proactive versus maybe waiting for injury, because I know a lot of people just wait until something hurts before they need help, right? So they're like, well, until it's really, really bad and I can't take it anymore, then I'll go see somebody like Travis and see if I can get this taken care of. So maybe just in terms of your practice and maybe what you're seeing from kind of the timeline too, what are you kind of seeing in terms of now people being proactive on things and saying, hey, I want to now do something about this. I'm starting to see some things, versus they're waiting towards the catastrophic end of things. And I'm in tremendous pain. And, I just couldn't take it anymore. Now I got to come see you. And what can you do for me? Like, talk about, I guess I'm interested in terms of maybe speed of recovery of things when things are a little bit alarming, versus like it feels very disastrous because I'm in tremendous pain, and maybe the recovery pattern for those.
Yeah, for sure. A couple main things there. You're right. And another good point to bring up is that Maine, we're very fortunate as physical therapists to have direct access. So that means you don't have to go for almost all insurance plans. Some insurance plans will still require you to get a physician's referral, but For most people, you can just contact us directly. You don't have to go see your PCP if you know you're having just a musculoskeletal issue. And so in that way, we have a lot of people who will come in very proactively. They start to feel some things coming up. They know it starts to limit their whatever their daily life activity is, and they're calling us right up to get in. Much, much easier to treat in that way than when it's been going on for 6 months, a couple of years. We are seeing too more people that are ultra kind of health conscientious, and they're calling us up just to look at something that they is not feeling right. Some of the issue that you run into there is if you're not, unfortunately, with insurance companies, if you're not having something that's limited in terms of your daily life, they don't really want to cover that. The cost is not exorbitant, so people will just choose to come in and pay and see us to try to correct problems before they become big problems.
Yeah, no, that's super helpful. And I think you can translate that across a lot of things of, being proactive versus waiting for a catastrophic injury or event. So that all makes sense there. And, I think this entire conversation, Travis, has been really helpful for us and hopefully our listeners. And, I do have a closing question for you. It's going to be a little bit different than the ones we've been asking. So that's where my transition is coming here. So I guess first I'll just thank you again for coming on our show and sharing your expertise and hopefully kind of breaking down that barrier, I think, if we opened with of the intimidation of people calling up someone like yourself to go make sure they're aging and staying mobile in the best ways possible. But my last question for you, Travis. So again, the name of our show, we're the Retirement Success in Maine podcast, right? We're just trying to help people find that successful retirement. So I have to ask you a retirement question now. So the question is, how are you going to find your personal retirement success when you get to that point? Like, what does that look like to you, you think?
Yeah, I like this because it's something that I do talk to so many folks about on a regular basis, just because I work with so many people who are at or very near retirement. And I think I've had the privilege of working with so many people around that age to show me what that can look like on both sides of the spectrum.
Yeah.
And so my answer here is not just because I'm a physical therapist and that's what this podcast is about, but honestly, this is what I see so often, that it's shaping my view that being healthy and trying to put myself in the best position to be healthy, because it's just so many who were able to get to that monetary level where they could comfortably retire, but maybe hadn't taken as good a care of themselves. Or, I mean, there's just so many things that are out of your control, but you control the factors you can. Or folks that simply waited too long to retire and then said, man, I wish that I hadn't waited, because now physically I'm not able to do all those things that I thought I was going to be able to do once I did retire. So that to me, I mean, I try to do the best I can to keep myself healthy and try to do the best I can to save money so that I'm not having to wait to the point where I'm too old to enjoy what I've done, and I'm healthy enough to do it. So I guess there's a lot of other things I can talk about there, but that's like the main one. Yeah.
That's a great answer. I really like it.
Yeah. Well, Travis, thanks for coming on our show. We really appreciate your time today. I know we'll put all the links to Deabay Physical Therapy on our site, and we'll backlink there too. But again, appreciate you coming on and just sharing your expertise today. Thank you.
Awesome. Thanks for having me. Appreciate it.
Yeah, you got it.
So, of course, Ben, that was another great conversation to have. I think, it really reinforced something that I know we talk about a lot on this show, but, retirement and retirement success isn't always about just the money factor.
That's right. Exactly. You can have the perfect financial plan, but if your body is not cooperating, it can seriously limit the things you want to do.
Absolutely. So again, just a huge thank you to Dr. Travis Deabay for joining us today. I know that was a fun conversation because I know we both personally kind of know him there, but it was really informative to hear from him as well. And hopefully everyone listening can learn a little bit about staying active and mobility and healthy.
Yeah. And again, I know I was trying to I had some of my experience in there, but I think the kind of the highlight of lesson is, look, anybody at any age really should be focused on these things.
Yeah.
And I think even just these small muscle things, you don't have to be, the Arnold Schwarzeneggers of the world. You can certainly just have the micro muscles be more in tune, keep your balance intact, are just going to all serve us all well as I think we age. So if you want to get in contact with Travis, or just want to check out his website, we will have that all linked, including the Titleist Performance Institute piece. So if you kind of have a golf slant that you're interested in, he can help with that. And he's one of the very few in the state of Maine that's doing it.
Yeah.
But you can go to our website, blog.guidancepointllc.com, /123. Not just a Michael Jackson song, but Jackson 5. It's also episode 123.
Wow.
So you can go to 123 there, and you can see more of our kind of our links there. Get over to Travis and check it out. So we thank you all for listening to our show today, Retirement Success in Maine podcast, and we'll catch you next time.